Alternating air mattresses are used for the prevention and management of pressure injuries and work on the principle of pressure on, pressure off. When air cells inflate, pressure is applied to the body's surface, creating a brief restriction of blood flow. When cells deflate, blood flow increases again, causing a rush of blood and therefore oxygen to the area. This is known as reactive hyperemia and is the body's normal reaction when we change position. Alternating air mattresses utilise this principle of reactive hyperemia for the prevention and management of pressure injuries. To get the most from your Active Air Acute 8, it is important to understand its key features and functions. There are 4 different modes. Alternating mode means that the cells move up and down in a 1-in-3 pattern. This encourages reactive hyperemia. This mode is vital to prevent and manage pressure injury and should always be used for those at high risk. Alternating mode will always default to a 10-minute cycle on initial setup. This is recommended for optimal protection and management. However, if clinical needs indicate, cycle time can be adjusted to 15, 20, 25 or 30 minutes by pressing the cycle button. Static mode stops cell alternation and brings all cells to an even level of inflation. This may be useful, for example, at meal times when the user wants a static surface. For protection, this will automatically revert to alternating mode after 20 minutes. Auto firm will also bring cells to static, but does so to maximum inflation. This mode is good for helping the user get in and out of bed and for lateral transfers. CLP, or continuous low pressure mode, also stops cell alternation and retains 50% of the selected pressure that has been set for the user. This makes the mattress a highly immersive surface, but should only be used if clinically indicated, as it does not provide the active therapy that alternating mode does. Turnassist is a patented feature only available in the Active Air Acute 8 system. Turnassist can tilt the mattress laterally to approximately 30 degrees, dependent on patient weight and position, to the left or the right, and reduce the workplace health and safety effort for carers to move and/or reposition a patient. It also minimises the amount of carer contact required when moving or repositioning patients, which can cause pain, unintentional bruising, or skin tears. To do this, firstly engage the auto firm button. Then initiate turn assist by pulling and twisting the yellow valve on the desired side of the bed to the turn position. The patient will begin to turn laterally to the chosen side with minimal assistance from carers. Once in position, one carer should support the patient while the second carer returns the mattress to the flat position. Reposition or attend to the patient as necessary. Encourage the patient to hold on to the side rail if fitted to the bed. Lateral tilt can assist with additional tasks such as changing linen, clothing and brief changes, sponge baths, slings and slide sheet positioning, and patient repositioning for pressure care. Ensure both yellow valves are in the flat position before leaving the client's room. The Active Air Acute 8 has a safety feature known as Auto Protect to prevent bottoming out in a more upright position. Auto Protect activates when the head of the bed is elevated past 25 degrees. Air pressure is automatically increased by 10 millimeters of mercury when the head of the bed is raised above the 25-degree angle. If the head of the bed is elevated past 45 degrees, the air pressure is automatically increased by 15 millimeters of mercury to prevent bottoming out in a more seated position. LL or LH will flash on the LED screen of the control panel when the mattress reaches a set angle of bed head elevation. This indicates the Auto Protect feature has been activated. Auto Lock means that after 30 seconds of inactivity, The control panel automatically locks and cannot be tampered with or accidentally changed, ensuring the setting stays consistent. To unlock the control panel, simply press and hold the lock button until the LED light turns off. Not only does the Active Air Acute 8 with Turn Assist have a patented protective feature to prevent accidental dislodgement, the cord itself can be retained on either side of the mattress for maximum safety, reduced tripping risk and convenience. The CPR valve is located at the head end of the mattress in an easy to access location. When it is opened, it allows rapid deflation of the mattress to enable more effective chest compressions when resuscitation is required. To open, pull the nozzle back and twist to the right to allow a fast escape of air. Along with the alternating cells, the cover helps to reduce pressure injury risk. It is breathable to optimise skin microclimate, multi-stretch to reduce friction and shear, and the seams are welded to prevent fluid ingress and infection control issues. For superior pressure care outcomes and manual handling assistance, choose Aspire.